Hey guys, it's Dr. Roberts, your Madison and Goodlettsville Chiropractor, and today's video we're going to be talking about Sjogren syndrome. Alright, so today we're going to be talking about Sjogren syndrome because today just happens to be World Sjogren's Day. And I've got a special guest with me today. This is Miranda. This is my wife.
Hi.
How we doing today?
Good.
Good, so she's a little nervous, but it's going to be easy. So why are we talking about this? And what is Sjogren's? Sjogren's syndrome is an autoimmune disease. And unfortunately, my wife was actually diagnosed with that a couple of years ago. So we're making this video and we're publishing it today to try to raise awareness for what Sjogren's syndrome is. And if anybody's watching this that might have similar symptoms, it's something that you might want to look into. So July 23rd is the day that we celebrate this because that's Henrik Sjogren's birthday. And in 1933, he discovered Sjogren's syndrome. So what is it? It's kind of spelled funny. It's actually spelled S-J-O-G-R-E-N, but it's pronounced Sjogren's. And what it is, it's an autoimmune disease that attacks your moisture-producing glands in your body. So in your eyes and in your mouth, it can cause some chronic dry eyes,
Right.
dry mouth issues, just all kinds of horrible stuff. And my wife was actually diagnosed with this a couple of years ago after years of having these weird symptoms that just kept getting misdiagnosed, and there wasn't any doctor that could actually put their finger and say, hey, you have this. But eventually, after going down the path of several doctors and several
Right.
people not knowing what was going on, we finally got the diagnosis of Sjogren's syndrome. So do you want to kind of discuss
Sure.
like the dental stuff and the eye stuff that we had talked
Yeah,
about?
for me personally, as a child, I had a lot of dental issues. I spent several years in a dentist chair, it seemed like, even as a child. So my baby teeth always had cavities in them and things like that. So that was kind of a big symptom for me. And then the older that I got, it became like an eye issue as well. So extreme chronic dry eye. And not just dry eye, like a regular dry eye, but an extreme painful dry eye. It feels like sand is in your eye all the time.
And you
So-
couldn't wear contacts either, right?
Right. Yes. So I have a nice collection of glasses because contact lenses are just not something that I personally can use, unfortunately.
And trust me, guys, this woman takes better care of her teeth than anybody that I've ever been around. She's always brushing, always flossing, and yet every time she goes to the dentist, she would have like a bunch of cavities or
Right.
have to have dental work. And it was just, things just didn't add up until we got the diagnosis, and then it was like light bulb goes off.
Right, exactly. And another thing too, so for me personally, the mouth is the biggest issue, followed by the eyes, and then also a classic Sjogren's symptom is skin. So extreme dry skin and dry hair and brittle nails and things like that. So I would say that's my third most common symptom also.
Okay. So, guys, I'm going to link in the description box below the link to the Sjogren's website. Also a link. I've got a fact sheet. I'm going to read some of these off, but there's all kinds of information. Again, in case you or a family member have experiencing some of these weird symptoms, nobody can give you the right diagnosis. You know something's wrong, and just nobody can help you. This is something that you may want to look into. So, again, this is the second most common rheumatic autoimmune disease in the U.S. It can affect 1 in every 70 people. It mostly affects women. About 90% of the patients are female. And typically they're diagnosed in their 40s. Wouldn't you?
I am not 40 yet.
So that's typically when they're diagnosed. Again, patients most commonly experience dry mouth, dry eye, fatigue, joint pain.
Yes.
and-
Joint pain is definitely
Yeah.
something that I struggle with as well. So, I would say widespread fatigue and joint pain
Fatigue,
is
yeah.
also something that is very well known to Sjogren's syndrome.
Right. And it's very common for patients that have Sjogren's to have other autoimmune diseases as well, whether that's rheumatoid arthritis, lupus, whatever the case may be. It's very common for patients to have more than one. And unfortunately, at this time, there's no cure for Sjogren's syndrome. So it's a matter of treating and just basically managing your life. So again, guys, we just wanted to raise awareness for Sjogren's Day. Please share this video. If you're watching this on YouTube, hit the subscribe button below as well as the notification bell. If you're watching this on Facebook, I encourage you to like and share. Thank you so much for joining me today.
Yeah,
I had to sweet
thank
talk
you.
her into it, but I think she did a great job. All right, guys, this is Dr. Roberts again. We'll see you next time.
This is basically an idea for you of what I have to use on a daily basis to kind of manage my day with Sjogren syndrome. And in this is a combination of medications, lotions, mouthwash, toothpaste, supplements, and things like that in order to get through the day.